Don't forget to like, comment, and subscribe for your regular dose of Asian health information.
What we can do to prevent, to develop crowded teeth. I think it's very important, even from a very young age, when the child is even 3, to make sure that all children are able to breathe well through the nose. Make sure that your kid is not snoring. Make sure that when they're lying down to sleep, they're sleeping and they're not tossing and turning. Things like tossing and turning, sleeping in weird positions is usually a sign that the child is trying to breathe better. Sometimes you hear snoring and you think that's cute, but that's actually a bad sign as well. So typically when it's very common now for children to have, we call allergies and nasal congestion, and it's so common that we take it as part of normal, but that shouldn't be the way. Because what happens is that when you have a nose blockage, the child is forced to breathe through the mouth. So when they breathe through the mouth, the jaw hangs open. So there's pressure from the cheek, and that actually prevents the jaw from growing to the ideal size. Furthermore, because the mouth is hanging open, it should always be closed, and then the tongue is there. So every time they swallow, the tongue pushes against the teeth and the jaw. It helps in the development of the jaw and the teeth. So by right, the teeth should follow the shape of the tongue, meaning the U-Y shape. But because of the blocked nose and the mouth breathing, the jaw doesn't develop well, and then the teeth gets crooked and gets crowded. So in order prevention, start from young. Make sure that the child is able to breathe well. There's no runny nose, no sinusitis or sinus problems. I think definitely oral habits play a part. For example, if you'd be surprised actually to move teeth, you need a very light force. The key is constant light force is able to move teeth, which is why clear plastic aligners or even a thin wire in braces, because it constantly exerts a light force on the teeth will move. So for example, if someone has a habit is always biting on the pen while they're thinking or concentrating, the process of pressure on the tooth would slowly the tooth would then slowly move. Chewing gum, I mean with everything else, I think things in moderation. So it shouldn't be chewing gum the whole day. A few minutes a day, I think that's fine. In fact, a bit of chewing gum also helps the jaw to move and exercise, so no harm with some chewing gum, especially after meal. For patients who have high decay rate, sometimes we recommend chewing gum after meal, just 10 to 15 minutes, just to get the salivary to flow, and that helps to prevent decay. When someone comes in asking for a smile makeover, I mean the term explains itself. They want to have like a brand new smile. So I think a nice smile, it depends on the person. It means different things to different people. So we spend a bit of time sort of like trying to uncover what's the reason for basically the smile makeover. And typically, we also educate patients on what a nice smile is all about. And it really boils down to what we call the A, B, and the C's. So a nice smile, a beautiful smile, has all 3 components like really nicely. So A will be alignment, meaning that the teeth have to be nice and straight in a nice smile. B is what we call brightness. So usually a nice smile, the teeth are white and bright. And then lastly is the part that most people are not so conscious of, meaning that they have straight or aligned teeth and the teeth are white, but they say, hey, there's still something wrong with my smile, it doesn't look quite good. And that's usually because the shape or the C part, the contour of the teeth are not right. Either the teeth are too square, the teeth are too long, or the gums are uneven, and you get the different contours there. So once we straighten the teeth and whiten it, then we usually look at what else we can do to further improve the shape of the teeth, or the contour of the teeth. And that's where cosmetic dentistry sort of comes in. Things like, you may hear of like veneers, or things like bonding. Maybe use a plastic filling to add onto the tooth to change the shape. So to go through from A to C in the smile makeover, it really depends on what our patient wants to so-called improve. Sometimes the teeth are already quite straight, so we can actually jump straight to the C part, just improve on the shape of the teeth. Sometimes all they need is just B, just to whiten the teeth, and they're actually quite happy. But most of the time we tend to start with A, because I think it's very important to have straight teeth. not only does it look nice, but I think once the teeth are straight, there are a lot of health benefits in terms of brushing, in terms of cleaning, in terms of function, and in terms of able to chew and bite well. So most of the time we tend to start with alignment, and typically to straighten the teeth, again depending on the complexity, I think most of the time it may take between 6 months to a year and a half for about vast majority of the cases, although there are some who might take a bit longer. And about the C part, meaning the veneers, those who are jumping straight to the veneers, the actual process is usually just 2 visits to actually prepare the teeth for the veneers and to put the veneers on, and the time difference could be about maybe 10 days. Yeah. So it can be quite fast, but of course before that we have the diagnostic visits, and then we do what we call a test drive or a test smile, where we sometimes put like temporary veneers on the teeth so as to give the patient a better idea of what the smile is going to be before they even contemplate starting.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.